Different civil society organizations under the Civil Society Budget Advocacy Group this morning gathered in Intendant to discuss the National Budget Framework paper for the financial year 2022 to 2023 that was tabled by the Finance Minister to Parliament for scrutiny.
They have issues. I think that's the urgent issue we need to deal with.
While addressing journalists today, CS revealed that one of the key issues they will be interrogating in the budget framework is as to whether it is answering key priority areas such as economic recovery and safeguarding livelihoods for Ugandans. According to CSOs, government should be condemned for the measures it put up to mitigate the COVID-19 pandemic, registering a growth in the economy that is also expected to grow in 2022.
We have seen modest growth, especially witnessed in the industry and services sector. The industry sector grew by 3.4%, while the services sector grew by 2.7%. According to the National Budget Framework paper, the economy is expected to grow at 3.8% in financial year 2021-22, and this growth is projected to about 6% in the financial year 22-23.
Patrick Lubagakere, a budget policy specialist with the CSBAG, advises government to be careful, especially when it comes to borrowing.
Government is borrowing a lot from the domestic market, which equally crowds out the private sector when it comes to credit. So we are calling on government to focus on, if they are to borrow, they need to target concessional loans, which has lower rates.
Government institutions have been advised to pay suppliers within 10 working days to reduce the domestic arrears. And on the same note, they want the question of financing for health addressed and the creation of a health insurance scheme.
Actually, World Health Organization says that for you to achieve universal health coverage, health insurance is key. And like the statement has clearly indicated that in Uganda we have only 3.9% of the population insured. And that is largely corporate. At the height of COVID, that number actually dropped to about 2% because a lot of corporates were downsizing. And so the number went down. Our prayer is that we have in place a national health insurance scheme that helps everybody when they have a crisis.
On the issue of education, members of the civil society say they want to see a plan for reinterrogation for students who became pregnant during the lockdown and also the policy on the education of refugees.
For school reopening to happen, you know what has happened, for instance, the issue of teenage mothers and students who are now pregnant. They need reintegration. In 2020, there was a study that maintaining a pregnant student in school requires about 30,000 more than a non-pregnant girl. So having that one costed into the school reopening plan would be very crucial for us to be able to maintain our pregnant teenagers and those who are breastfeeding in school.
At the moment, the different committees of Parliament are continuing to have different discussions with the different stakeholders ahead of the reading of the budget that will take place in June to mark the start of the financial year 2022 to 2023. Story by Daniel Echwalu for CTV, PM Edition.